Continuing in chapter 21, opioids. This is definitely something that gets a lot of press coverage recently. This is a narcotic type pain medication that can produce sleep as well as an altered mental or altered level of consciousness as well. An opiate is just a specific subset of the opioid family that refers to the natural or non-synthetic opioids. Opiate is naturally occurring. Opioid is something that they make in a lab. Opioids are named because they're made from the opium that's derived in poppy seeds. Codeine and morphine are the two that are created from this poppy seed. Then you have the synthetics, which are the opioids. You've got meperidine, hydromorphone, oxycodone, hydrocodone, and methadone. The prescription drugs are pretty much the most commonly abused drugs in the United States. Some people can become physically dependent even after taking a prescribed dose. The death rate from heroin overdoses has also tripled between 2010 and 2013. It's all the way up to 44,000 deaths, and that's just heroin. That doesn't take into account anything else. Opioids are a CNS depressant just like alcohol, but they can cause severe respiratory depression, which is typically what's going to cause the biggest issue. Tolerance tends to develop very quickly, so users may require like legit massive doses to experience the same high that they were experiencing to begin with. Opioids typically cause nausea and vomiting and can lead to the development of low blood pressure or hypotension. Patients appear very sedated, can be unconscious. They have pinpoint pupils, meaning that the darkened portion in the center of their eye is very, very, very small. The only time it should be like that is in extreme light conditions, and this will be that way with anything else. If they get to the point of those pinpoint pupils, oftentimes they have a little bit of respiratory depression at the very least, which can cause them to be cyanotic. Oftentimes it's the respiratory drive suppression that really gets people into trouble, and once they go into respiratory arrest, cardiac arrest follows pretty quickly. So what do? We give patients naloxone. So this reverses the effects of opioid medications. They actually compete for the same receptors. So that Narcan or naloxone ends up covering up the receptor that is stimulated by opiates, and they can't actually stimulate that receptor. Narcan can be given IV, intramuscularly, or intranasally. Most EMS systems will allow the EMTs to administer via the nasal route, and so you have a little thing that you would put on the end of the syringe. It's called an atomizer, and you spray half of the dose in each nasal. And you only want to really use Narcan when the patient has severe respiratory depression. We don't want to wake patients that have opioid overdoses all the way up, because they're just going to be pissed that you took their high away. So if the patient has agonorespirations or is apneic, is breathing super, super slow, you may want to put in an airway adjunct and bag the patient up. You want to try and keep them adequately ventilated so they don't get a hypoxic brain injury in the meantime. And then start giving little doses of that Narcan until you get them up far enough that they're breathing adequately. We don't want to wake them all the way up. You may want to ask bystanders if the patient was given Narcan prior to EMS arrival. Now that people can buy it over the counter, some people just Good Samaritanly will drive around with that in their car just in case. So if they've already been given some Narcan, you want to be careful with how much more you give to them. Sedative or hypnotic drugs. Um, these are two general classes called barbiturates and benzodiazepines. They're pretty easy to obtain. They're relatively cheap. They're also CNS depressants and alter your level of consciousness, very similar to those that have taken in a lot of alcohol. Patients may appear drowsy, peaceful, or intoxicated. Um, for the most part, these are going to be taken by mouth. Every once in a while, somebody will take the capsules and break them open and then suspend it in water and inject it. But really, I mean, not a whole lot. IV sedative hypnotic drugs quickly induce tolerance, so they need increasingly larger and larger doses. Some of the drugs that are given often have different names to them, a knockout drink or a Mickey Finn, date rape, those sorts of things, because they render the person that ingests it relatively unaware of their surroundings. For us, treatment is typically just going to be to provide a patent airway and assist ventilation. Abused inhalants. These are inhaled instead of ingested or injected. Acetone, toluene, xylene, hexane often are the compounds that people are trying to inhale. They're typically found in glues, cleaning compounds, paint thinners, and liqueurs, or lacquers, excuse me. Gasoline and various halogenated hydrocarbons, such as freon, are used as propellants and aerosol type sprays, are commonly abused as inhalants. Oftentimes it's going to be a teenager that's going to do this. The effective dose and the lethal dose are very, very close. So these are super scary. Kids don't really realize how bad inhalants can be. We want to take very special care in dealing with a patient who has been utilizing an inhalant. Oftentimes, the hydrocarbon solvents that they end up using makes the heart very sensitive to the patient's own adrenaline. And so even just having them walk can actually take them into a fatal ventricular dysrhythmia or a rhythm in their heart that is incompatible with life. So we want to be very careful, try and keep them from struggling or overexerting themselves, use a stretcher to move them, give oxygen and transport to the hospital. Hydrogen sulfide is a highly toxic, colorless, flammable gas and has a very distinctive rotten egg odor. Poisoning usually is going to occur by inhalation. Hydrogen sulfide affects all the organs, but it has the highest impact on the lungs and the central nervous system. Often used to commit suicide. It's referred to as chemical or detergent suicide. If you approach an enclosed vehicle with an unconscious patient inside, be alert for any sort of warning signs such as buckets, pots, other containers, or if you suspect the presence of a toxic gas, wait for the hazmat team. Otherwise, you're going to go opening up doors to this vehicle and get a face full of it, and it's nasty stuff. This became a huge thing, I'd say probably about 10 years ago. It kind of resurfaced as a popular way to commit suicide, and some of these larger cities were having responders getting poisoned on a regular because they weren't taking the proper precautions. Signs and symptoms: nausea, vomiting, confusion, dyspnea, loss of consciousness, seizures, shock, coma, and cardiopulmonary arrest. Once your patient has been decontaminated, most of what we're going to do is just supportive care, monitor respiratory and cardiovascular function, and then provide rapid transport. Sympathomimetics, they mimic that effect of the fight or flight nervous system. They regularly cause hypertension, tachycardia, and dilated pupils, so the exact opposite of your opioids. They're also called uppers rather than depressants. So they produce an excited state. These would be your amphetamines, methamphetamines, amphetamine sulfate. You also have a couple of other what they call designer drugs. So MDMA, ecstasy, or Molly are also very frequently abused in the United States. Oftentimes these are ingested orally as well, but can be injected. Cocaine is in this class here, and it can be taken a number of different ways. It could be absorbed through all the mucous membranes, even across the skin. It has immediate effects that include excitement and euphoria, typically less than an hour. You can smoke cocaine as well, and that's the most rapid means of absorption, and so it has the most potent effect. People often snort it as well. Acute overdoses, they're a genuine emergency. People that have overdosed have a huge risk of seizures, cardiac dysrhythmias, and strokes, and even the young, healthy people. Patients often experience hallucinations or paranoia, which place us as responders at risk. We should have law enforcement officers there to restrain the patient if necessary, and don't leave them unattended during transport. They can be very, very unpredictable. Patients need prompt transport to the ED, and we're going to give oxygen and suction as necessary. Synthetic cathinones, known as bath salts. This is very similar to ecstasy or Molly. They sell them as bath salts because it's like, hey, they're not drugs, they're bath salts. We can't say how people are using them. They produce euphoria, increased mental clarity, or what the user perceives as increased mental clarity, as well as sexual arousal. Most users of the drug either snort or insufflate the powder nasally. Effects can last up to 48 hours, so it's pretty long acting. Brand names also include Ivory Wave and Cloud9. Adverse effects, teeth grinding, appetite loss, muscle twitching, lip smacking, confusion, GI upset, paranoia, headache, elevated heart rate, and hallucination. Try and keep the patient as calm as possible, and consider ALS assistant just because patients may require chemical restraint so that you can transport them safely to the hospital. Marijuana is definitely abused throughout the world, and it's becoming more and more normalized for people just to be on it. Nearly half of Americans have tried marijuana one time or another. The chemical within it, THC, actually is what produces the high. Inhaling marijuana smoke produces euphoria, relaxation, drowsiness. It impairs short-term memory and the capacity to do complex thinking and work. However, the euphoria that you might experience to begin with can progress to depression and confusion. With very, very high doses, patients may experience hallucinations or become anxious or paranoid, and some people really don't even need a lot. That's how they respond, irregardless of how much they've taken in. Oftentimes, what we have to do is just transport them, try and keep them calm. Oftentimes, marijuana is used as the way to get other drugs into the body. It's often laced with something else, or something else is laced with marijuana. So several states have legalized the recreational use of marijuana, and others allow medical use, but they do allow products that contains THC. So you have like edibles, baked goods, candies, other food additives that have marijuana in them. You can have cannabinoid hyperemesis syndrome, which is characterized by chronic marijuana use, which leads to extreme nausea and vomiting. and is only relieved by a hot shower or bath. And then we add on synthetics, and we'll talk about that in a minute.